If you're over 60 and you wake up tired, forget little things during the day, or your partner says you snore loudly, your brain may not be getting the oxygen it needs while you sleep. Many people dismiss these warning signs as just getting older, but researchers have found that nighttime oxygen levels may play an important role in memory, concentration, heart health, and healthy aging. Today, we'll look at 7 silent signs that deserve your attention. Number 1 surprises many people. Let's talk for a moment about why oxygen matters so much while you sleep. Your brain is a remarkably hungry organ. Even though it makes up only about 2% of your body weight, it uses a much larger share of the oxygen you breathe in every single day. During sleep, your body cycles through different stages, and in some of those stages, particularly deep sleep and dream sleep, your breathing muscles relax more than usual. For most people, this isn't a problem, but for others, especially as we get older, the airway can narrow or partially collapse during these relaxed moments, causing brief pauses in breathing or shallow breaths. When that happens repeatedly through the night, oxygen levels in the blood can dip up and down, sometimes without the person ever fully waking up or remembering it in the morning. This pattern is often referred to as sleep-disordered breathing, and one well-known form of it is sleep apnea. Research suggests that as we age, changes in muscle tone, airway structure, weight distribution, and other health factors may increase the likelihood of these breathing interruptions. This doesn't mean everyone over 60 has a breathing problem. It simply means the risk tends to rise with age, which is why awareness matters. I want to be clear that experiencing 1 or 2 of these signs occasionally does not mean something is seriously wrong. Our goal today is simply to help you recognize patterns that may be worth discussing with your healthcare provider. Let's move into our first sign: waking up with morning headaches. Many people brush off a headache as nothing more than dehydration or stress. But researchers have observed that some morning headaches may be associated with fluctuations in blood oxygen and carbon dioxide levels during the night. When breathing is interrupted repeatedly, the blood vessels in the brain can respond to these changes, and some people wake up with a dull, pressing headache that tends to fade within an hour or 2 of getting up. Of course, morning headaches can also come from tension, poor sleep posture, dehydration, or even certain medications. So this sign alone doesn't point to one specific cause. What makes it worth paying attention to is the pattern. If you notice these headaches happening several mornings a week, especially alongside other signs we'll cover today, it may be worth mentioning to your doctor. A simple conversation and, if needed, a sleep evaluation can help clarify what's going on. Now let's move to a sign that often gets talked about, but rarely taken seriously enough. Sign number 2 is loud snoring with pauses in breathing noticed by others. This is one of the more recognizable signs, yet it's often laughed off at the dinner table instead of being looked at seriously. Loud, persistent snoring can happen when air struggles to move smoothly through a narrowed airway, and the surrounding tissue vibrates as a result. In some cases, a spouse or family member may notice something more concerning than snoring alone. Moments where breathing seems to briefly stop, followed by a gasp or snort as breathing resumes. Researchers have studied this pattern for years, and it remains one of the more recognizable indicators of possible sleep-disordered breathing. That said, not everyone who snores has sleep apnea, and snoring alone doesn't confirm anything. Many factors can contribute to snoring, including allergies, sinus congestion, alcohol use before bed, or simply sleeping position. Still, if a loved one has noticed pauses in your breathing during sleep, that observation carries real value, and it's worth bringing up at your next medical visit. Sometimes the people who love us notice things about our health before we do ourselves. Our third sign is extreme daytime sleepiness despite sleeping all night. This one can be confusing because it doesn't seem to make sense on the surface. You went to bed at a reasonable hour, you were in bed for 7 or 8 hours, and yet you still feel like you could fall asleep in your chair by mid-afternoon. Here's what may be happening beneath the surface. If oxygen levels dip repeatedly through the night, the brain may briefly rouse itself over and over to restore normal breathing, even if you never consciously remember waking up. These micro-arousals can fragment sleep in a way that prevents the deep restorative stages your body relies on. So even though you technically spent enough hours in bed, the quality of that sleep may have been disrupted. Of course, daytime sleepiness has many other possible explanations too, including certain medications, thyroid changes, depression, or other sleep disorders. This is exactly why doctors often ask detailed questions about sleep quality, not just quantity, when evaluating fatigue in older adults. Sign number 4 is memory lapses and difficulty concentrating. I want to pause here and be very clear about something important. This video is not about dementia, and forgetting where you put your keys does not mean anything serious is happening in your brain. With that said, research suggests that when the brain doesn't receive consistent oxygen during sleep, and when deep restorative sleep is repeatedly interrupted, some people notice changes in short-term memory, word finding, or the ability to concentrate during the day. Scientists believe this may be connected to how the brain processes and consolidates memories during certain sleep stages, work that appears to happen most efficiently during deep, uninterrupted sleep. Memory and concentration can also be affected by stress, certain medications, vitamin deficiencies, thyroid issues, and simply the natural changes that come with normal aging. If you notice new or worsening memory difficulty, especially alongside poor sleep quality, that combination is worth discussing with your healthcare provider, who can help sort out what might be contributing. Our 5th sign is waking up frequently to urinate at night. On the surface, this seems completely unrelated to oxygen levels, but researchers have found an interesting connection. When breathing is repeatedly interrupted during sleep, changes in pressure within the chest and shifts in certain hormones can influence how the kidneys and bladder behave overnight. Some studies suggest this may contribute to more frequent nighttime urination in people with sleep-disordered breathing. Of course, this is also an extremely common and often harmless part of aging, and it's frequently related to prostate changes, bladder function, fluid intake before bed, certain medications, or diabetes. If you're waking up multiple times a night to use the bathroom, it doesn't automatically mean anything is wrong with your oxygen levels. But if it's happening alongside snoring, morning headaches, or daytime exhaustion, it may be one more piece of a larger pattern worth mentioning to your doctor. Sign number 6 is dry mouth or a sore throat every morning. This sign often gets overlooked because it seems minor, but it can actually offer a clue about how you're breathing at night. When the airway narrows during sleep, many people unconsciously shift to breathing through their mouth instead of their nose in order to get enough air. Mouth breathing overnight can dry out the tissues of the mouth and throat, leaving you waking up with that parched, scratchy feeling. This can also happen simply from sleeping with your mouth open, using certain medications, allergies, or a dry bedroom environment, so it's not a definitive sign on its own. But if you consistently wake up with a dry mouth or sore throat, especially paired with snoring, it may be worth mentioning to your doctor as part of the bigger picture. Our 7th and final sign is high blood pressure that remains difficult to control. This is a sign that many people don't immediately connect to sleep, but the research here is fairly well established. Repeated drops in oxygen during sleep can trigger stress responses in the body, including the release of hormones that temporarily raise blood pressure. Over time, night after night of this pattern may make blood pressure more difficult to manage, even with medication. Doctors sometimes refer to this as resistant hypertension when blood pressure remains elevated despite appropriate treatment. Naturally, high blood pressure has many possible causes, including diet, genetics, stress, kidney function, and other health conditions. But if you and your doctor have struggled to get your blood pressure under control despite trying several approaches, it may be worth having a conversation about your sleep quality as one possible contributing factor. Now let's clear up some common misunderstandings, because misinformation around this topic is incredibly common. Myth number 1: snoring is always harmless. While many people snore without any underlying issue, snoring can sometimes be a signal worth paying attention to, especially when paired with other symptoms we've discussed today. Myth number 2: everyone who snores has sleep apnea. This simply isn't true. Snoring is extremely common, and most people who snore do not have a diagnosed breathing disorder. The difference often comes down to whether breathing pauses are occurring, which typically requires a proper evaluation to determine. Myth number 3. If I don't feel tired, my sleep must be healthy. Some people adapt to poor sleep quality over such a long period that they no longer notice the fatigue as clearly. This is why other signs, like morning headaches or blood pressure changes, matter just as much as how tired you feel. Myth number 4. Oxygen drops only happen in people who are overweight. While body weight can be one contributing factor, sleep-disordered breathing can affect people of any body type, including those who are at a healthy weight. Airway structure, muscle tone, and age all play a role too. Myth number 5. Memory loss automatically means dementia. This is an important myth to address directly. Memory lapses can stem from dozens of causes, including poor sleep, stress, certain medications, and normal aging. A single symptom is never enough to diagnose anything, and only a qualified healthcare provider can properly evaluate memory concerns. Myth number 6. Sleeping longer always means sleeping better. Quality matters just as much as quantity. Someone can spend 9 hours in bed and still wake up exhausted if that sleep was repeatedly interrupted throughout the night. Now let's look at 3 fictional educational stories to help bring these ideas to life. These are illustrative examples only, not real patients. Our first story is about Robert, a 72-year-old man who noticed he was waking up most mornings with a dull headache and found himself dozing off during his afternoon television programs. His wife had mentioned for years that he snored loudly, but he had always brushed it off as something to joke about. After watching an educational program similar to this one, Robert decided to mention his symptoms to his doctor. His doctor asked several detailed questions about his sleep and referred him for a sleep evaluation. Robert learned that his breathing was being interrupted many times each night. With his doctor's guidance, he began treatment, and over time, his headaches became less frequent, and he felt noticeably more alert during the day. Our second story is about Linda, a 68-year-old woman who had been waking up 2 or 3 times a night to use the bathroom for years. She assumed it was simply a normal part of aging. When she mentioned this alongside her constant morning dry mouth during a routine checkup, her doctor asked more questions and discovered a pattern of disrupted sleep. After further evaluation, Linda and her doctor identified contributing factors and developed a plan together. She learned that addressing her sleep quality made a meaningful difference in how she felt during the day. Our third story is about James, a 76-year-old man who had started noticing that he was forgetting small things more often, like appointments and names of people he had just met. Understandably, this worried him. He spoke with his doctor, who took his concerns seriously and asked thorough questions about his overall health, including his sleep patterns. Testing revealed that James had been experiencing frequent nighttime oxygen drops. His doctor explained that this was likely a meaningful contributing factor and worked with him on an appropriate treatment plan. James felt reassured knowing that his memory concerns had an understandable and treatable explanation, rather than assuming the worst. Before we continue, I want to take a moment to talk about warning signs that require urgent medical attention. Not next week, not tomorrow, but right away. If you or someone you know experiences sudden confusion, sudden difficulty speaking or understanding speech, sudden weakness or numbness on one side of the body, severe chest pain, serious difficulty breathing, or loss of consciousness, please seek emergency medical care immediately by calling emergency services. These symptoms can indicate a stroke, heart attack, or other medical emergency, and time matters enormously in those situations. Please don't wait to see if symptoms improve on their own. Now let's shift towards something more encouraging, because there's a lot within your control when it comes to supporting healthy sleep and healthy aging. While no single habit can guarantee prevention of any condition, research has associated several lifestyle factors with better sleep quality and overall health as we age. Regular walking and physical activity have been associated with better sleep quality and cardiovascular health. Maintaining a healthy weight for your individual body may help reduce strain on the airway during sleep. Some people find that side sleeping, rather than sleeping flat on the back, may help keep the airway more open, though this varies from person to person and is worth discussing with your doctor. Regular medical checkups allow your healthcare provider to monitor changes over time and catch potential concerns early. Treating hearing loss when present has been associated with better cognitive engagement and communication. Managing blood pressure through a combination of lifestyle habits and, when appropriate, medication remains one of the most well-supported strategies for long-term health. A Mediterranean-style diet, rich in vegetables, whole grains, healthy fats, and lean proteins, has been associated with numerous health benefits in research studies. Practicing good sleep hygiene, such as keeping a consistent bedtime, limiting screens before bed, and creating a calm sleep environment, can support better rest. Periodic medication reviews with your doctor or pharmacist can help identify whether any medications might be affecting your sleep. Avoiding smoking and limiting alcohol, particularly close to bedtime, may also support healthier breathing patterns during sleep. And finally, maintaining social activity and mental engagement has been associated with overall well-being as we age. None of these habits are guarantees, and this video is not meant to replace personalized medical advice. But small, consistent choices made together with your healthcare provider can make a meaningful difference over time. Let's bring everything together. Today we covered 7 silent signs that may be worth paying attention to. Morning headaches, loud snoring with breathing pauses noticed by others, extreme daytime sleepiness despite a full night in bed, memory lapses and difficulty concentrating, frequent nighttime urination, dry mouth or sore throat each morning, and blood pressure that's difficult to control. I want to remind you clearly that none of these signs, on their own or even together, automatically mean you have a serious medical condition. Many of these symptoms have simple, everyday explanations. But if you're noticing a pattern, especially several of these signs occurring together, it's absolutely worth having an open conversation with your doctor. Early conversations can lead to helpful answers and, in many cases, real improvements in how you feel day to day. Has anyone ever told you that you snore loudly, or do you often wake up feeling exhausted even after a full night's sleep? Let me know in the comments below. I'd love to hear from you. If you found this video helpful, please consider giving it a like, subscribing for more educational content like this, and sharing it with a friend or family member who might benefit from this information. I'm Alan Mercer, an AI-generated educational presenter created to explain evidence-informed health information in a simple and accessible way. I'm not a real physician, and this content is for educational purposes only. Always consult your own physician or another qualified healthcare professional before making decisions about your health.